Many of my patients will ask me, what is TMS and what does it stand for? And I tell them TMS is a truncation for transcranial magnetic stimulation. And then they ask me what that is. And I say, well, this is where we run electricity through a magnet that produces an electromagnetic pulse that goes through the skin, muscle, and bone and touches the brain and activates brain tissue. And we do that to actually treat various disease states. The idea that certain disease states may have brain areas that are under or overactive, and we can use tools such as TMS to re-regulate those brain regions and networks so that people have a resolution of their symptoms. And then they're usually pretty excited because they want their symptoms to go away. And there's a specific type of TMS called deep TMS, again, that has been FDA approved for smoking cessation, OCD, and depression. It tries to target prefrontal cortical areas and also areas of the brain called the insula. And between that, it gives people a better chance of having cognitive control, the ability to say, yeah, I'm gonna wait, I'm not gonna smoke that cigarette, and actually reduce their cravings.
So I've started smoking when I was about 11 years old. I'm 44 years old now, and so I've been smoking most of my life. I enjoyed smoking. Once I got addicted to cigarettes, I just felt like I didn't want to quit.
Most people know that smoking cigarettes is really bad, but for people who are smoking, they don't feel this immediate health diminishment. This is something that usually happens over years. And so that's one of the challenges with people trying to stop smoking cigarettes is they're not immediately having a heart attack. They're not immediately having a cancer. But by the time they've had those things, it's almost a little late.
For years, I just felt like I enjoy smoking. I'm just gonna I'm just gonna do it. I've quit before, but no more than for, like a half a day. I've never really quit for more than that. I did feel like I was ready. This would have been my last attempt. I told myself that I'm just gonna, I'm gonna give it everything that I can. If it's not gonna happen, it's not gonna happen.
Despite use of behavioral therapies and nicotine replacement therapies, less than half of people are successful at actually stopping smoking by a year. So there's clearly a need for other tools and technologies to help people quit smoking. I think that there's a real opportunity for people to employ deep TMS technologies, potentially in primary care, not just within psychiatry, and that the idea that people become more familiar with the idea that we can directly intervene on the brain in a very non-invasive and safe way and give people control again.
It's been 7 months. I don't even really think about it anymore. It's amazing what this technology has done. There's methods out there, proven methods now, to help you quit smoking. It's actually very doable. I've been smoking all my life, a pack a day almost. To be that heavy of a smoker and go from that to zero, it's not an easy task. This treatment enabled me to do that.
It's great to see how deep TMS can intervene over a matter of weeks, give people control again so that they can stop smoking on their own. And they're not needing to continue some type of medication or therapy to stop smoking. And it's been really transformative for people to see them throw away their ashtrays and save their money and actually take their money and put it in a money jar and buy something nice for themselves because they didn't realize they were spending $10 a day on cigarettes until they stopped. So it's been really gratifying actually as a physician to see people quit smoking with deep TMS and sing the praises later.